Having a healthy pregnancy is one of the best ways to promote a healthy birth. Getting early and regular antenatal care improves the chances of a healthy pregnancy. In this video, we will be discussing the common pitfalls I have seen people fall into over the years in pregnancy. Number 1. Delay in starting antenatal care. The earlier you start attending antenatal care, the better. You should then attend antenatal care at least once a month until 28 weeks, then twice a month until you are 36 weeks pregnant. During the last 4 weeks of your pregnancy, you should go weekly. Number 2. Not regular on medication. The safest thing to do is to start folic acid when you are preparing to get pregnant to prevent neural tube defect. Once you missed your period or you get pregnant, your doctor will place you on some drugs. Folic acid, ferrous, vitamin B complex, vitamin C, calcium, vitamin D, and so on. The choice of the drugs you should take will depend on your doctor's evaluation. Take at least 2 doses of TT and other vaccinations as recommended by your doctor. Number 3. Delaying treatment for febrile illness and infection. A pregnant woman with a temperature of 38 and above should see a doctor who will evaluate and determine the cause of the fever and then give a prompt treatment. This is important especially if there are other symptoms. 4. Not minimizing stress. Researchers found that women who had major negative life events or psychological stress exposure were twice as likely to have early miscarriages. The same review found a link between workplace stress and miscarriage, which definitely brings to light the importance of making adjustments early in pregnancy. This may be especially necessary if you work a night shift. Another studies also link stress to preterm birth, delivery before 37 weeks of pregnancy. Preterm babies are more likely to have developmental delays and learning disorders. As adults, they're more likely to have chronic health problems, like heart disease, high blood pressure, and diabetes. But note that most preterm babies do very well. Please subscribe to our channel to know when we post a new video on how to stay healthy. 5. Abnormal eating. When you are pregnant, you need more of certain nutrients like protein, iron, folic acid, and iodine. It's also important to get enough calcium. Making smart food choices can help you have a healthy pregnancy and a healthy baby. Here are some ideas to help you eat healthy during pregnancy. Follow a healthy eating pattern. Eating healthy means following a healthy eating pattern that includes a variety of nutritious foods and drinks. Eat a variety of vegetables, fruits, whole grains, fat-free or low-fat dairy products, and protein foods. Choose foods and drinks with less added sugars, saturated fats, and sodium. Limit refined grains and starches. If you are feeling sick, get medical attention quickly. Do not try to eat for 2 people, because if there is a rapid weight gain due to unhealthy eating habits, you are prone to develop diabetes and hypertension in pregnancy. Weight gain of about 1 kilogram per month is allowed for those who started with an ideal body weight and BMI. Make sure all foods or vegetables are properly cooked. 6. Not exercising at all. The more active and fit you are during pregnancy, the easier it will be for you to adapt to your changing shape and weight gain. It will also help you to cope with delivery. Keep up your normal all daily physical activity or exercise like yoga, dancing, or even walking to closed shops and back for as long as you feel comfortable. Moderate exercise is not dangerous for your baby. There is evidence that active women are less likely to experience problems in later pregnancy and labor. Please note that those with high-risk pregnancy should avoid exercise. So ask your doctor to know whether your pregnancy is high risk or not. 7. Taking paracetamol every day. Although paracetamol is safe in pregnancy, it should not be used continuously. 8. Not doing all the necessary investigations they need to do is another common mistake we see now. Antenatal tests are an important part of your pregnancy care and help make sure that you and your baby are healthy throughout your pregnancy. Different types of tests, including blood test, urine tests, and ultrasound scan, are used to check different aspects of your own and your baby's health. Some tests are recommended for everyone, while others are offered only to women at a greater risk of a particular condition. Some antenatal tests are screening tests to help prevent the transmission of some diseases to your baby. 9. Not keeping a pregnancy note or antenatal notes which will contain A. LMP, B. IDD, C. The investigations you have done, D. Vaccines taken, A. Ultrasound result, F. Blood pressure, G. The drugs you have been using. If you must travel, take your maternity notes along. Confirm your due dates and let your doctor or midwife confirm that you are not at risk of any complication. Please subscribe to our channel to know when we post a new video on how to stay healthy. 10. Self-medication. Self-medication in pregnancy is one of the riskiest behaviors you must avoid. Taking medicines that have not been prescribed by a medical professional is a dangerous and increasingly widespread practice. This risk is even higher for pregnant women, since they not only endanger your health, but can also cause malformations in babies. Self-medication can also cause chromosomal alterations and death of the embryo. It can also produce various congenital malformations visible at birth or appear later in apparently healthy newborns. 11. Smoking in pregnancy. If your health isn't enough to make you quit smoking, then the health of your baby should be. Mothers who smoke are more likely to deliver their babies early. Preterm delivery is a leading cause of death, disability, and disease among newborns. 1 in every 5 babies born to mothers who smoke during pregnancy has low birth weight. Mothers who are exposed to secondhand smoke while pregnant are more likely to have lower birth weight babies. Babies born too small or too early are not as healthy. 12. There is no known safe amount of alcohol used during pregnancy or while trying to get pregnant. There is also no safe time for alcohol use during pregnancy. All types of alcohol are equally harmful, including all alcoholic wines and beer. Alcohol in the mother's blood passes to the baby through the umbilical cord. Alcohol used during pregnancy can cause miscarriage, stillbirth, and a range of lifelong physical, behavioral, and intellectual disabilities. These disabilities are known as fetal alcohol spectrum disorders. Children with fetal alcohol spectrum disorders might have the following problems: abnormal facial features, such as a smooth ridge between the nose and upper lip, small head size, shorter than average height, low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school especially with math, learning disabilities. The list goes on. It is never too late to stop alcohol use during pregnancy. Stopping alcohol use will improve the baby's health and well-being. Fetal alcohol spectrum disorders are preventable if a baby is not exposed to alcohol before birth. Please note that knowledge is advancing by the day and we will like to always post an update about this. Thanks for watching. Please subscribe to our channel to know when we post a new video on how to stay healthy. You are watching Zoom Hospital channel and listening to work of Dr. Kayode. Thanks for watching.